Namaste. Today I am going to be talking about lifestyle diseases, the diseases which have been linked to the lifestyle that we've been leading. It can be summarized in one word, that is metabolic syndrome or syndrome X, which I would be talking about today. Almost 2 decades back, the burden was of infectious diseases or communicable diseases. With the invent of anti-malarial medications, antibiotics, and many more medications, infectious diseases have been well controlled. Tuberculosis was not treatable earlier, but now it is completely curable. So with the advent of good medications, we have achieved controlling our infectious diseases. Many vaccines have come up to help polio, smallpox, and so many things. And we are at the verge of eradicating polio kind of diseases. And we have already eradicated smallpox with effective vaccination. But in the Western world, in contrast to India, it used to be all these non-communicable diseases of diabetes, heart diseases, strokes, hypertension, and so on. But with rapid urbanization, better buying powers, and with the invent of technology and medicine, India has been seeing the shift from infectious diseases or the communicable diseases to the non-communicable diseases. In rural India, in fact, we see a double burden, both of infectious as well as these lifestyle disorders. It is high time that we recognize them and work towards the betterment so that we can definitely control this burden. Otherwise, it is going to pose a huge economic burden on India. So if we classify the most common lifestyle diseases, cardiovascular diseases like heart diseases, strokes, diabetes mellitus, COPD or chronic obstructive pulmonary diseases or lung diseases, chronic bronchitis, asthma, then cancers, gastrointestinal tract diseases like ulcers, gastroesophageal reflux disorders, constipation, and so on. Then genitourinary diseases like stress incontinence, recurrent urinary tract infections, and so on. And then neuropsychiatric disorders. So these are the most common diseases which are associated with lifestyles. And in India, the first four, which are diabetes, COPD, cancer, and cardiovascular diseases, are extremely common. So what causes these diseases? It could be broadly classified as non-modifiable risk factors and modifiable factors. So your age, gender, your genetics, ethnicity, Indians and Asians being predisposable to these cardiovascular diseases. But certain factors are there which are absolutely modifiable, like sedentary habits and physical inactivity, then high calorie food, which all leads to a weight gain. And that coupled with smoking and increased salt intake, it predisposes to many other diseases. The work from home culture during the COVID enforced lockdowns have further increased our sedentary habits and high calorie food intakes, and which has in turn led to an increment in body weight. Even kids, they didn't go to school, they have been sitting at home, no physical activity at all. So all these things together constitute what is called the metabolic syndrome. If we look at metabolic syndrome, what causes it? It is all the excess fat or the visceral fat which leads to increased blood sugar levels, increased triglycerides, insulin resistance, increased blood pressure, a lot of inflammation and oxidative stress, which all leads to a lot of lifestyle diseases like diabetes, cardiovascular diseases, polycystic ovarian syndrome, neurological disorders, strokes, and fatty liver, and so on. So when we talk about metabolic syndrome, there are certain diagnostic criteria. abdominal obesity, especially waist circumference of men more than 40 inches and in women more than 35 inches, hypertriglyceridemia or increased levels of triglycerides in the lipid profile, which is more than 150, low HDL or the good cholesterol, or high density lipoprotein cholesterol, which is less than 40 in men and less than 50 in women, high blood pressure of more than 130 by 80, high fasting blood sugar levels, which is more than 110. And metabolic syndrome is diagnosed if at all 3 of the above 5 factors are present. So typically in metabolic syndrome, you see an apple-shaped body because of this abdominal obesity. And as I always tell you, the visceral fat or the fat around your abdomen, that is inside your visceral organs of liver and pancreas, actually constitute what is called insulin resistance, and that in turn leads to non-alcoholic fatty liver disease, diabetes, cancers, polycystic ovarian diseases, which all in turn are precursors to cardiovascular issues. So it is extremely important that we recognize this and rectify the same. Other lifestyle disorders includes cancers. So our life patterns like smoking can lead to lung cancers. Environmental pollutants also constitute. Charred smoked food, the incidence of colorectal cancers have been on the rise. Then if we talk about lung diseases, air pollution has been extremely common and it is associated with a lot of pulmonary disorders like bronchitis, asthmas and so on. Prolonged sitting leads to a lot of constipation and gastroesophageal reflux disease and so on. Lot of spicy food and sauces actually leads to a lot of GI issues. I have seen people who had an esophageal tear following the consumption of pizza with chili flakes on it. Then musculoskeletal disorders. Lot of osteoporosis and fractures are extremely common. In the past, women used to work in the kitchen and all the work would constitute a lot of strength training, flexibility and so on. But today, with the advent of technology and easy devices to do all our grinding, mixing, there is no much activity unless until you hit the gym for strength training and so on. So this leads to a lot of reduction in bone density, leading to osteoporosis and fractures. Then, as I said, we have seen a rise in PCOD followed by infertility cases. Needless to say, mental illness has also increased drastically, leading to a lot of insomnia or sleeping issues, which in turn increases the blood pressure and the risk of other diseases. If we follow the right lifestyle with regular exercise, healthy eating choices, managing stress, sleeping well, and having a comfortable and contented life, we can all keep these lifestyle diseases away. Thereby, a huge economic burden is reduced. As all of you know, health is wealth. So take care and bye.